listeners, and welcome to another episode of OSP's podcast, The Digital Health Show. In our podcast, we have been looking at some of the biggest healthcare challenges and then discuss how advancements in technology can potentially solve those same challenges. Now, with the current COVID-19 crisis, are you one of those providers who want to help their patients stay healthy while also generating consistent revenue? Or are you a provider who has patients with chronic illnesses thinking twice about coming in for their weekly or monthly doctor visits? If you're either one of those, then this episode is definitely for you, as I'm going to discuss how to decode the remote patient monitoring mystery and the benefits they offer. First things first, what are remote patient monitoring solutions? Remote patient monitoring, or RPM, is the use of digital technologies that allow healthcare providers such as yourself to monitor and electronically capture health data from your patients for assessment, recommendations, and instructions in real time. It's a form of virtual care where you can measure patient data such as blood pressure, vital signs, weight, heart rate, and blood sugar levels without ever seeing your patients live. Freedom for both you and your patients. And patients can stay in their homes safe or be on vacation or be seen literally from anywhere. So will RPM play a significant role in the delivery of healthcare going forward? Recent statistics say yes. A 2019 Spyglass Consulting Group survey found that 9 out of 10 healthcare providers had invested in or were currently evaluating RPM technologies. Another Amwell service found that 1 in 4 consumers stated they would switch to a new physician in order to access telehealth. And this year, Medicare further increased its reimbursement rates for remote patient monitoring to an average of $120 per patient per month. As these and other stats prove, both providers, patients, and the government believe that RPM solutions are going to be an integral portion of our healthcare beyond 2020. So, why is it that they seem or why they feel that RPM is so important? Well, from you as a provider's point of view, RPM solutions reduce hospitalizations and reduce readmission rates, thus improving patient outcomes and improve compliance rates and minimize healthcare costs. And don't forget, as part of accountable care, that also increases your reimbursement rates for your patient visits. As RPM is payable by Medicare and many Medicaid programs and private payers too, you as providers can generate ongoing revenue by providing RPM services. Think about it. If you even saw 15 patients a month or 50 patients enrolled in your RPM program, you can generate approximately $72,000 a year in revenue, which is not bad. From a patient's perspective, remote patient monitoring systems can provide detailed information on their personalized health, faster access to healthcare services, and actually provide greater influence of their own well-being and in their course of care through ownership of their own health data. RPMs also allow older and disabled individuals to live longer at home. Now, when we see its advantages, let's talk a little bit about how RPM works and how to get an RPM solution set up. So first, a provider needs to identify the conditions that they want to manage remotely and launch an RPM program. That provider would then determine patients who would benefit from that RPM service. So coming up with a concise and consolidated list of who to focus on first. Third, patients are then provided with a Bluetooth or cellular networking connected device to collect health data. Some commonly used RPM devices are blood pressure monitors, weight scales, blood glucose meters. There are even RPM kits that are now becoming readily available on the market. Next, once the device is set up appropriately, health data is electronically captured by the device and transmitted from the patient to you, the provider. The provider then analyzes that data, and you guide the patient based on those results. Lastly, you as the provider are going to transfer patient-generated data from the patient to the care team and back to the patient in those cases that need care collaboration. Now, I'd like to just give you an overview of some of the useful features in RPM solutions that can help you and your patients have better interactions and outcomes. Wireless vitals collections. It's an intelligent RPM system that not only collects vital signs from wireless devices, but also identifies regular conditions and sends emails and text messages to you, the provider. Patient education. Through RPM services, providers can educate their patients and ensure they have thorough knowledge of their health conditions, their risks, things to avoid, diets to adjust, and so on. Better integration with wearable gadgets, between smartphones, wearable devices, smart devices. The choices are becoming endless as to ways to engage with our patients. And RPM devices are no different. They can be integrated into the system, such as a camera-fitted wearable, glasses for the visually challenged, wearable device for cardiac patients, etc. Lastly, notifications and reminders. RPM solutions can be designed and set up to set notifications for your patients about their virtual visits with their physicians, times when they need to take their medications, times when they need to perform certain tests, whether that be ECGs. And you can also set reminders for activities such as fasting, urine tests, and stool sample testing. In conclusion, RPM is here, and it is only going to consistently grow as it provides greater flexibility for you, the physician, as well as for your patient base. And it's going to also solve longstanding problems of scarcity of experienced medical professionals in many rural markets. As developers of RPM solutions, we're excited to see how RPM evolves as more and more providers adopt these solutions and transition to a value-based care model. Thanks for listening to our podcast today, and we'd love to hear your feedback. Stay tuned for more health tech updates in our next episode.